See, when a child takes in a button battery and when this button battery comes into contact with the mucosa of the stomach, it starts releasing alkali, and that might cause a reaction, that might cause a perforation or wider than 2 to 3 centimeters that is unlikely to pass down. So then you should visit the emergency. Good morning. Today we shall be talking about foreign body ingestion in children. So what are foreign bodies? So foreign bodies are basically things which should not be taken in, but the children have mistakenly or accidentally taken inside their mouth. So uh, what is the age at which such foreign body ingestions they come to us in the hospital? So generally, it is the age from about 6 months to 3 years of age when children are experimenting, when everything is new, and they put anything and everything that comes to their hand, they put it in their mouth, and accidentally sometimes they swallow it. And that is when the parents you as parents start panicking and seek specialist help. So what are the various types of foreign bodies that are seen that children take in? So, well, anything under the sun. The common things which children swallow are coins, and then with the advent of a lot of electronic toys and all, these have become very cheap. So these batteries, button batteries, so coins, button batteries, pins, hair clips, parts of toys, pins, anything. Children can almost intake anything. So the big question is what to do and when to come to a hospital. So, what to do? The first thing that you should do as parents is not to panic, because the fact is that most foreign bodies, they naturally come out in the stool. It is only in a small fraction that they remain within the gastrointestinal tract, and that is when we need to intervene. So, when should you see a doctor? Obviously, you should always see a doctor. Please see your local pediatrician, or if you are nearby any hospital and it is beyond your doctor's clinic hours, then you attend the emergency. But when is it that it is mandatory to come to the emergency as early as possible? So, as I said, most of the times it is not an emergency, but there are certain types of foreign bodies which are categorized as high risk foreign bodies, like button batteries. See, when a child takes in a button battery and when this button battery comes into contact with the mucosa of the stomach, it starts releasing alkali, and the mucosa, the inner lining of the gastrointestinal tract, maybe the food pipe or the stomach or the intestine, that starts getting damaged, and that might cause a reaction, that might cause a perforation. So if it's a button battery, if you realize that the child has taken a button battery, you must visit the emergency as soon as possible. Often children play with magnets, so if they take up magnets, large magnets, then you should visit the emergency as soon as possible. If the foreign body which has been taken in is large, I mean, if it's longer than 5 to 6 centimeters or wider than 2 to 3 centimeters, that is unlikely to pass down. So then you should visit the emergency. Or obviously, if the child is symptomatic, as I said, most of the children are without symptoms, but if they are symptomatic, that means if they are constantly coughing, or they are having chest pain, abdominal pain, unable to swallow, and if there is continuously saliva or is drooling, that means saliva is coming out. So these are the times when you should come to the emergency. So where all do foreign bodies get obstructed? See, our gastrointestinal tract, if if you would remember from your early biology days, it contains a food pipe, then a stomach, then a small intestine, and then a large intestine or the colon. So there are about three places in the food pipe where it might get obstructed. If it passes through the esophagus into the stomach, for all practical purposes, it should move on, but it might still get held up at the pylorus. What is the pylorus? It is the place where the stomach ends and the small intestine starts. So if it passes the pylorus, then again, for all practical purposes, it should come out of the stool. There is a small chance that it may get stuck in the IC valve or the ileocecal valve. That is the place where the small intestine ends and the large intestine or the colon starts. So if these are the places where a foreign body might get stuck, so what do we do? What we do is, if it is none of the high risk foreign bodies, then we do serial x-rays, we monitor the child, and if it is beyond 12 hours, 24 hours and the foreign body has not passed, then we do an endoscopy to remove the foreign body. Most of the foreign bodies, almost more than 95%, are removable endoscopically. But in the rare case where it gets stuck in the small intestine, that is a case when surgery might be needed. Having said all this, I come back to my initial what we discussed, that most foreign bodies are not a cause for immediate panic, and a careful follow-up and a visit to a specialist is warranted. Thank you.